All right, so we shall segue. Sorry, just catching up here. Next, we're going to be joined by Dr. Forrest. Thank you so much for being here today and for joining us. I know you've been hanging out with us for a while as well, so thank you. So Dr. Forrest is a PA, professor and founding program director of the Master of Science Physician Assistant Program at California State University, Monterey Bay, CSU Monterey. He taught full-time at the USC Primary Care PA program for 10 years prior to Monterey Bay and has over 30 years of clinical experience as a PA in family medicine, pediatrics, and internal medicine, urology, and urgent care. Being of Nicaraguan descent, Dr. Forrest was raised Spanish-speaking. His parents instilled in him a heart for the Latino culture and a clear commitment to caring for the underserved. He has led students on medical mission trips to Honduras and Nicaragua. The focus of his doctorate was providing culturally sensitive healthcare for Latino migrant farm workers. He was the guiding influence for the mission statement at CSU Monterey Bay to provide a culturally resonant care to the underserved communities. He designed the program to include an integrated conversational medical Spanish course for the entire first year and built time and schedule for students each week to go out and serve the local community in Salinas. Under his leadership, the program is focused on training students from disadvantaged communities to go back and serve those communities.
Thank you, Jose Luis. I appreciate the introduction.
Yeah, it's amazing. Thank you for being here. I'm excited to hear.
Well, thank you. I'm sharing my screen here. Can you see it?
Yes.
Perfect. Okay, well, welcome everyone. I'm going to be giving you a brief overview of our program. And what you'll find out is every program has certain unique aspects to them. We have a lot of commonalities because we're accredited by the same institutions, but which is RPA, but we each carry a different mission statement or slight differences in our mission statement in how we express, operationalize the program. So I'm from California State University, Monterey Bay. We're an accredited program, currently on probationary status, but we're in the process of applying for full accreditation. This is our mission statement. Our mission statement is to train highly qualified, culturally resonant medical providers to serve the health needs of underserved communities. And we basically put everything we have as far as the focus of our program into this mission statement. What you see here in the background is are the fields of Central Valley near Salinas, filled with strawberries and lettuce fields, and the students pass by this every day on their way to our campus. What you'll see in these fields are migrant farm workers working in the area, and the health needs in the area are extremely high. So our goal is to meet those needs. Here's an image of our first, here's a photograph of our first cohort. This is within a week of them being accepted to be our PA program. We'd already done orientation and we got them together for this photo. Take a look at it. And typically what I do is I ask in the chat what type of things people notice. But take a look at this, and I will tell you that what most people see first is the happiness. There's something really great about getting into PA program, and you can see it coming through their pores. The diversity, just take a look through them. The other thing that you'll notice is this has been maybe 1 to 2 weeks into the program. Look at the relationships between them. Some have their arms near each other, whatever. They become a family very, very quickly. And part of that is we break down the competitiveness in our program by making it competency-based and eliminating the final ranking as I graduated first, second, third, fourth in my class. That creates a lot of competition. So what we do is we just try to break down those barriers as much as possible.
Although as a Giants fan, you seem to have a New York Yankee fan, and I'm, just kidding.
We accept people from all backgrounds.
I know, but Yankee fan, I don't know. Just kidding.
I realize that. The broadest overview is that we're a 28-month program. The first year is, generally speaking, classroom instruction. The second year are clinical rotations. And the last year is a hybrid semester, where it's 2 days a week of clinic, so that the students can get a longitudinal experience with the patients, follow-up visits, et cetera. They can build relationships with the patients. It also allows the students to be well known by the staff and the physicians there, so that when it comes time for looking for jobs, they know them, they know how they function, and it often translates into jobs. The other part of the hybrid are courses preparing them for their professional practice, and we're going to go through that in just a few minutes. These are the courses in the program. Now, you'll find a lot of courses that are same across all PA programs. Things such as evidence-based medicine, some programs incorporate that into their other courses. We have it set out, not that we don't have it in the other courses, but we have a special course dedicated to that. Some programs include pharmacology, pharmacotherapeutics in their clinical medicine course. You can't tell the two apart from each other, and they work synergistically, and that's a great model. We've elected to put it out separately because we've noticed that it seems to be a weak point for a lot of students when they graduate. So we have pharmacology, pharmacotherapeutics every semester for the first year. So clinical medicine, advanced A&P, evaluation, education, clinical skills, behavioral medicine, these are all every semester for the first year. Mission practice is also every semester. What that is, you heard what our mission is, to care for the underserved. Mission practice is a chance to put that into action. Most students have had volunteer experiences to get into PA programs, and then the volunteering stops, and that shouldn't happen. So we built a course to make sure that that fire stays kindled, that we're able to continue that desire and acknowledgement that we're in a service profession. So students can do any type of service that's hands-on with the community. And so students will work in all different types of areas, from with the homeless, different types of food distributions, et cetera. And there's some great opportunities there. Medical conference. Oh, one more thing. The mission and practice course we schedule for Friday at the end of the day. So from 2 to 5 or 3 to 5 is the mission and practice course. Students aren't obliged to do that, the volunteering during that time. They can take off that Friday early, as long as they put in that time sometime over the weekend or during the week. So we've worked it out to try to help promote the work-life balance for the students and still achieve our mission goal. Medical conversational Spanish. A lot of Spanish that students learn is in college, it's all written. You do the translations, the tests, exams are in writing. But if you ask someone who's taken 1 or 2 years of Spanish in college to get into conversation with you, most people would say, I really don't know it that well. I can understand the words, but I can't really speak. And so we found that in this area, the amount of Spanish clinics in the Central Valley among the migrant farm workers and the different populations here is huge. Some of them will say they won't take students unless they speak Spanish. So we require students to have 1 year of Spanish, undergraduate Spanish, to get into the program. And if you already speak Spanish, you can place out of that. And then what we do is we go into the anatomy, physiology. When you're learning how to do the physical exam in English in your patient evaluation course, we're teaching you the same equivalency in Spanish. When you're doing cardiac exams, we'll teach you the cardiac terminology to be able to discuss with the patients. When you're discussing different types of pharmacotherapeutics, we'll give you instructions on how to explain to the patients how to take their medicines and what type of foods to take them with. We expect our students to be able to do the full history, examination, and patient counseling afterwards, all in Spanish. And within that year, we're able to do that. But it's a fair amount of work, and you need to have that groundwork of the equivalent of 1 year of Spanish to do that. Evidence-based medicine. In the third year, we have a graduate project, which is a capstone project. The idea is to give back to the community, do some type of public health project. We have a professional practice seminar. Imagine this, a board review course that lasts your whole last semester. So 1 day a week, you're taking a board review course, and you're reviewing everything from with guest speakers that are experts in the area. And by the end of that, you're graduating, and it puts you in a really strong position to be able to take the national boards. And I'll show you the national board data later on, but it really does help. And the professional practice seminar, it's not enough for the students to be able to know all the material. They have to be able to apply for their license and board certification. We guide them through that. They need to be able to create a CV or a resume that's going to speak to the physicians in the area and is going to help sell them as having the experience to be able to practice as a new PA there. We put them through mock interviews. We teach them how to do the interviews, and then we have employers in the area come in and put them through mock interviews. There's no better experience than that to prepare someone for their practice. And then we review with them the laws of the profession. There's a number of other things we cover just to make sure that they're ready to graduate. I inserted this in because I saw a lot of places we're talking about, well, what's the schedule like? Well, we have a modular system. We call it a spiral curriculum. It builds on knowledge from the previous weeks. But we'll do on, let's say, cardiology. We'll do anatomy and physiology Monday morning, technical skills in the afternoon, which means different surgical techniques, examination skills, pharmacology, clinical medicine, meaning diagnosis and treatment of different diseases. It moves on to clinical skills, which is how to examine the heart at that point, and then patient edge are case-based scenarios in how to deal with cardiac issues. Sprinkled in between there is some behavioral medicine, which is cultural competency, interacting with communication skills and interacting with the populations. We have medical conversational Spanish and the mission of practice course. Wednesday morning is an independent group study. This allows students just to have a little bit of breathing break during the week, but it is a full week. It is 9 to 5 essentially. Added value, we've talked about many of these. The medical conversational Spanish course, a lot of the students say they came to our program primarily for that. And we found out later on, once we started putting people into rotations, that a lot of rotations really appreciate that. And they'll request students that speak Spanish or even moderately speak Spanish. We talked about the service course. Point of care ultrasound training. We have a faculty member who's done a residency in emergency medicine, and she learned how to do a point of care ultrasound. And she's turned around and said, this is going to be the future X-rays in the future. So she trained our students on how to do this, and not only how to read it, but how to take it, and to the point where the students can check out the devices to go to some of the rotations in remote areas and be able to help with some of the screening and increase access to care for some of these sites. We include some mindfulness modules, the capstone course. We talked about those. So here, every picture you see in the program are pictures of our students. None of these are taken off of any that were in the internet. We're a green program, so textbooks are all online. We've signed up for Access Medicine, all the major type of publishers through the bookstore, through the university library, and the students can log in and access all the textbooks online. There's very few exceptions to that. The only exceptions are there's 1 or 2 books that aren't published digitally, and so we have no choice on that. We avoid paper handouts. Everything is done on the iPad, on Canvas, on PDF, PowerPoints, etc. iPad, we provide the iPads. So we were blessed to be able to have donations of iPads in the past. And even if there isn't a donation, the university has agreed to purchase iPads for the students. So this is, we're providing this as part of the tools. This is what students need in our program. It's also recommended that you have a laptop because there are some exams that are nationally based that really are made for a laptop and not app-based. And so you can arrange to borrow those as needed or whatever, but you have to have access to a laptop. We do video recording on OSCE exams. I'll explain that. Anatomage table, point of care ultrasound. The best way to describe these is to show you. But with the iPads, we have Apple come down, train our students on all the different tricks on how to use it. One of the students wrote this on their iPad during the training. This is so dope, life-changing. Well, she's graduated since, and I've asked her, you remember what you wrote? I says, yeah. How do you still feel that way? She says, yes, I wouldn't have been able to get through PA school without it. It revolutionized the way that I take notes, the way I study, the organizational skills. It was tremendous. So our students really love that. Instead of having cadavers, we have a digital, equivalent of digital cadaver. It really is, they're actually cadavers they're imaged and placed in here. So they are real bodies. They're not illustrations. And it's somewhat similar to a large iPad. You can see on the right here, you can set the image so that you have different depths. You can go on the surface and dissect through, or you can go down and look at any of the body systems individually, identifying things. The faculty will place pins on different things during anatomy, and the students will need to go and make sure they're able to identify the different structures. The beauty of this, number one, is it doesn't smell. If you've had to work with formaldehyde before, you know what I'm talking about. And the other one is once someone has operated on the eye on a cadaver, no one else can do that. That cadaver's, that's the end of that possibility for that cadaver. On this, you hit the reset button. And so it's just amazing to be able to do this.
I can see if they've had like endocarditis or an infection on the actual valve. We can actually see what's called vegetation.
Now, take a look at this.
We can make sure that I can see if they've had like.
See where she's aiming the probe? The probe is
is
aimed at the student's heart. And so the structure that you see opening and closing there are the valves of the heart. This is happening in one of our regular classroom exam rooms. This is the tool, like I say, that we teach the students to be able to use. And this is just a regular iPad. And these are some probes that we purchased. And this can connect into an iPhone or into an iPad. And you can set the different depths on this image. It's revolutionary. It's an amazing way to be able to examine. And some of our students decide that they want to make sure they get the certification on it. They can get national certification for entry-level ultrasonography on this. So we encourage students to do that. Many of them have. I'm going to go through a number of photos, and I'm going to go through them rather quickly, just to give you a feel for the program. There's patient evaluation courses where students examine each other. That's one of the best ways to learn. We have technical skills courses teaching students how to suture and IND. In this case, this is the head of the emergency department at Natividad Hospital, which is the county hospital nearby. And he's come down to teach our students. We have a number of different people that are experts in the area. And the students have fun learning how to cast and suture. This is our faculty teaching students how to do the suturing. We convert one of the classrooms into a surgical suite with a mannequin here, and they will teach the students how to do all the aseptic technique. It's a great way. It's a very versatile way to learn. We've built exam rooms into our program with all the equipment, so you wouldn't be able to tell whether you're actually in a clinic or in our program. And so we use these rooms to teach our students how to, in this case, it's a pediatric module. And we had some of the faculty and staff and students bring in their children voluntarily if they wanted to, and learning how to interact with the children is really a skill. And you can see the children really loved it. And let's see here. So just going through some of these photos and get a feel for what it's like in PA school. We would put health fairs on in the community. We'd bring literature on diabetes, My Plate, hypertension diet, low salt diets, etc., in English and in Spanish. And we provide the information to the students in both languages, to the attendees that came by. So these are exam rooms I talked about. We call these OSCE rooms. We do objective structured clinical exams in these. There's what you don't see is there's a couple cameras up at the top. So the students will go in, they'll do a mock exam on a patient. It'll all be filmed. The patient will have a script, and we're able to review the recording afterward and let the students know how they did. Students can see how their technique needs to be improved. It's a great way to learn. So we have 7 of these rooms. Moving on to the clinical year. These are the names of our clinical rotations. I'm not going to go through and describe each one of these, but most of these, you'll see that we have a lot of primary care here. We actually have 2 family medicine rotations, internal medicine, pediatrics, women's health. We're not a primary care exclusive program, but we do focus on that. And selectives are our version of electives, but we ask that they be in areas that will supplement primary care, because our mission is to the underserved in the area. There are 4-week clinical rotations with 1 week coming back for national exams on the subject matter, for additional training, to meet with their advisors. Students all have faculty advisors, and they have a student mentor in the year ahead of them. This is just to give you a feel for some of the clinics that we have that students have rotated through. The names keep on changing. I can't keep track of them all. Prerequisites, everyone asks about this. You can see this on our website, and I'm hoping that that they'll be able to post that in the chat area. But the biology, chemistry, we don't require organic chemistry, okay? Microbiology, one microbiology course, separate human anatomy and separate human physiology, because this is going to be the foundation of what you're going to be doing. This photo on the right, this is what you're going to be doing with patients. You're going to be examining them. You need to know all this foundation in order for us to be able to build on it. Non-sciences, we require a statistics course, not an intro for English majors. It needs to be for science or math majors. We required English composition when we started, and we'll accept any writing intensive course, anything that requires a large paper or that builds on your writing skills, because writing is an important part of PA program. You're going to be doing a lot of writing. And then Spanish language, as we talked before, 1 year, or passing a placement test. And we have a free placement test through the university that we can offer. What do we look for in an applicant? Well, the requirements are simple: a bachelor's degree from an accredited university in the United States, and all the details are on our website. The total and prerequisite science GPAs need to be above 3.0. Now, let me tell you, prerequisite science. Notice, organic chemistry was not there. Physics was not there. There's a number of other science courses that some students may not do well in. We don't count those. So if you've done poorly in those, that doesn't count toward prerequisite science. Prerequisite science are the sciences you see here: biology, chemistry, micro, anatomy, and physiology. So, and CASPA will keep these separate. And then we do require patient shadowing. And I'll tell you why. Whereas that before, we had one student who made it all the way through the didactic year and got to the clinical year and said, I don't like this. This is not what I thought it was. Okay. I didn't want to take the risk of students saying, oh yeah, I know what a PA does, and they really haven't shadowed, because it isn't until you shadow that you realize what life is really like. And so you don't have to have hundreds of hours. We required 8 hours. Very simple, but just want to make sure that you know what you're getting yourself into. Patient care experience, to be competitive, we ask for over 1,000 hours. Have we taken people with 500 or less? Yes, but that's not very competitive. They'd have to have some other major strengths. Same thing with community service. We look for over 500 hours. Once again, this is our mission. We want to know that students have the desire to care for the underserved. And 2 letters of reference, we ask that one be from a PA to be competitive. And the reason for that is no one knows better what's required to make it through a PA program than a PA who's been through it. So if a PA writes a letter of recommendation, says, I know what it's like to get through PA school, this person has what it takes, that's a lot better than a professor somewhere who, not that you can't have a reference letter from a professor, but for them to say that you have what it takes to get through a PA program, they don't know it from the same perspective as a PA. So that's the rationale there. Now, on the next slide, I'm going to show you, look at these numbers. These are the minimums or the recommended, but let me show you what the realistic data is. Our cumulative GPA across 4 cohorts is 3.37. We're not necessarily looking for 4.0s. We're looking for people that meet our mission. Now, we do have some 4.0 students in our program, but we have just as many that are 3.1, 3.2, 3.8 in the low 4s, because we're looking for people that are going to meet our goals and our missions. So if you're interested in working with the underserved, that really is where your heart is. Make sure your personal statement reflects that, and we want to consider you. Although 8's required, the average amount of shadowing that a PA has done is 215. Okay. Although patient care hours, we recommend 1,000 and we'll take less. The average is 4,688. Community service, we recommend 500. We've taken people with 200 hours, but 791 is the average. And the average age of application, and this is pretty much true across all PA programs, is 26. So if you're 23, 24, and you're just saying, well, maybe I'll never get in, patience, deep breath. Okay, the average age is 26 at the age of application. And GRE, we don't ask for GRE. We consider that a barrier for people from underserved backgrounds to get into our program. To be able to have the money to take the GRE and to take a GRE prep course. It's been shown that if you take a GRE prep course, you score much higher. We just don't want that advantage given to students that are coming from underserved areas. Our cycle is different than most, okay? Our program begins in January. So we begin accepting applications October 1st, and it closes when CASPA closes April 1st. We do not do rolling admissions. So if you're interested in our program, it's in your best interest to make sure that you submit your application toward the middle of March, end of March, so you have as many possible hours logged in for all the other prerequisites we talked about. Make sure all your classes are complete, et cetera. This gives you time to make sure to do that. And then after April 1st, we're going to review all those as a whole. And we do a holistic admissions process, interviews in 2024. Our interviews are friendly interviews. The students who've been through our interview process say that that was the main reason why they chose us. They really felt the collaboration, the family atmosphere. We have the students speak, we have the applicants speak with our students, we speak with our faculty. We do 2 faculty on 1 student for an interview, but a lot of it is information gathering. And we try to get a real feel for who you are, not just the black and the white that's on the application. Everyone asked about the PANCE. All the questions, most of the exam questions that we give in the program are in PANCE format. So we're training you to be looking at these type of questions all the way through. The last semester is the board prep course, and we've had 2 cohorts that have graduated so far. We're getting ready to graduate our 3rd. The pass rate has been 100%, but as you heard from the previous presenters, everyone pretty much eventually passes for the PANCE. What you look at is the first time pass rate, and we have 90%, 97% for the first year cohort and 97% on the second year cohort. What that means is one student didn't pass on the first time. Now, considering that our GPA, average GPA is a 3.37 or 36, we're taking students that are from underserved areas that are disadvantaged for us to be able to bring them up to the rate to where they're equivalent to any other PA out there with a 97% first-time pass rate, I think is pretty remarkable. So this is the official form, 97%. Compare this to the national averages here, 97% compared to 91, compared to 93, compared to 89. We're above the average in all these areas. Program accomplishments. These are photos of students that we've had who received National Health Service Corps funds, either full tuition scholarships or loan repayment scholarships. Because we do a lot of care for the underserved, we do get the recognition from NHSC. We do get recognition from Song Brown, which is the state, for working with primary care underserved. We also, accomplishment is the POCUS point of care ultrasound technology, the Natomage table, these OSCE suites, which are really high technology. And we were nationally recognized in the Journal of PA Education, saying that Spanish is the most commonly spoken non-English language in the US. Faculty at Keck School of Medicine of USC and Cal State Monterey Bay programs evaluate medical Spanish proficiency in PA students. From day one, it's repeat after me. Uno, dos, tres. Cabeza, lengua, corazón. It's all spoken. The exams are spoken. And so it's, this is a whole different way of teaching Spanish. So why CSUMB? We position our students for success. We've got quality faculty. The courses prepare the students for national boards. We have supplemental study tools. We pay for Roche Review, UWorld, a number of other different study tools for the students that help give them an edge in preparing for their final board exams. The clinical rotations are in the community, which means it's just lends itself to job offers if they like you. Realistic patient skills training in those OSCE rooms, Spanish course, and that whole hybrid semester that gives the mock interviews and really prepares students for their profession. So in closing, we're a mission-based program. We're really focused on underserved communities. We have a competency-based curriculum, which means we don't rank each other. It's if everyone passes, everyone passes. It's just built on standards. So there's a very high collaborative atmosphere. And you can see just by the students in this picture, they went down to the beach, which is not far away, to take this photo. Family atmosphere, family values. The faculty are very supportive. We focus on student success. We've got a high board passing rate. And this is our information. And hopefully this is also in the chat so that you can see this. But if you want any more information, please reach out to our admissions counselor. If you're preparing to apply, they will guide you through all the things that you need to make sure that you've gotten your application to have a successful submission. Okay. Open to questions.
Thank you. That was excellent. And I definitely think the CSU Monterey, you know, we've seen it's unique in a lot of really, really interesting ways, really cool ways. We have one of our first questions is asking if you accept American citizens who completed their bachelor's degree from a foreign institution. And if so, do you require a TOEFL exam?
No, it's an accreditation requirement for our program that they have to graduate from a United States accredited institution. And once again, all the details for what I've said are all on our website.
For students coming in who are interested in, serving under service communities and the Spanish-speaking community, but maybe they're really nervous about the Spanish-speaking and the ability to learn, what would you say to them coming in? You know, it sounds like the school is obviously very geared towards making sure the students are successful, right? But it's a big barrier.
We're really geared toward making them successful. If they're able to speak enough to get by the time they finish the program, That's good. We don't expect them to be completely fluent. However, we do everything possible to create an environment where there's no intimidation. All the students speak at the same time. We break them into groups, into pairs, and they practice with each other. We keep the pairs changing along. We have experienced speakers that may have been speaking since they've been born, so to speak, and we pair them with them so the students can hear the accent and hear the way that they speak. And we create an environment where it's not just learning the vocabulary, it's a lot of it, more than half of it's just practice.
And a wonderful opportunity it is. There is a question that I think do you offer housing options for students that are from out of state?
Absolutely. The university has on-campus housing available to graduate students, and it's at a discounted rate. So it's very affordable. I don't know what the rate is going right now, but compared to all the housing in Carmel and this whole area, it's extremely affordable. Yes. In fact, most of the faculty live in the same housing type of areas.
Yeah, I can imagine. It's beautiful in Monterey, but not necessarily cheap. For the clinical rotations, a follow-up question there as well. We have are they close? How does the housing work? You would elaborate on that.
Absolutely. We will place you. Students don't have to look for their own placements. We'll find, we basically have sites within 100 miles. If it's outside of a 100-mile radius, then we will ask the students if they want to go. And in some cases, the students will request those sites because the reason why they're even on our list is because they're exceptional. And so those type of things stand out. But I'd say most of the sites are within a half-hour drive, 45-minute drive of the program.
What does it mean for the program to be under the probation status during the accreditation, and how does that affect the students?
Great question. What it means is that we're under the gun for accreditation to make sure all of our paperwork is impeccable, and the requirements for the paperwork are quite stringent. And so for a new program trying to get off the ground doing this, it's a high learning curve. And so we're still in that learning curve, so to speak. However, it's a category of accreditation. So it's an accredited program. As you can see, we're graduating students. Students are getting jobs. They're doing well on the PANCE. There's really, from a student perspective, there's no difference. From a program's perspective, we're spending a lot of time behind the scenes doing a lot of extra paperwork.
Yeah, a lot of paperwork. And so you taught full-time at USC for
Yes.
years before you decided to come to Monterey Bay, and now you're leading the program. So it seems like you also had a lot of experience with dealing with that paperwork you mentioned.
Yes. Yes.
Let's see. Sorry, scrolling through. Oh, does Monterey Bay, do they allowed to have outstanding prereqs at the time of application? Can they have classes in progress, or does it all need to be done before the time they send out an application?
All the science prereqs need to be complete at the time of application, because we use that as our primary basis for making decisions on things. However, if the other ones are in progress, they need to be complete by the time we're looking at by the time CASPA closes. But yes, they can be in progress during the time the CASPA is open.
We've had speakers today, and obviously yourself mentioned how important volunteering and being of service is. In terms of the program, are there any kinds of experience that are more highly prized, or?
I would say this: if you're applying and you're filling out something for volunteer service, don't forget the service that you did when you were in high school. Okay, I want to know where your heart is. Okay, so if you're volunteering at the we have an aquarium nearby, and if you're volunteering taking tickets at the aquarium, that's not the same as working in a soup kitchen, or even in high school, part of a church group, making sandwiches for the poor to hand out on the street, peanut butter and jelly, whatever it is. We want to see that you have the heart, that you've been trying to help those that are underprivileged for as long as you possibly can. We want to see the longer you have that, the better.
And a sort of follow-up question there as well. Does CSU Monterey Bay have a supplemental application for the PA program?
Yes and no. Okay. Once we go through the CASPA and we select you, the university has to go through a formality of an application. And once someone's going through the interview process, we'll have them complete that. But it's not a decision-making process. It's just a matter of having the university be able to verify the transcripts and the information that's on the CASPA application. So it's a second verification process, but it doesn't exclude anyone.
Got it. We have, would spouses of students be accepted into school affiliated housing?
Yes, we do have family housing. So if we have, many of our students are married, and some of them have children, and so we're used to that. And they do have a family units, which are basically a 2-bedroom, 1-bath condo type of situation, and those are available for families. And so, actually, let me backtrack on this. It's 3-bedroom. 3-bedroom, 2-bath, I believe is what it is. And they're condos and they are available for families.
Excellent.
As available.
Also have, sorry, just scrolling through here, Doctor, give me one moment. Thank you for your patience. And thank you for running through so many of our questions and providing us with so much insight. It's really great to have you here. For a pre-PA students looking at California State University Monterey Bay, what are some of the priorities in terms of the mission statement you think are, highlight a good applicant?
Well, clearly they have to have the minimum GPA, but GPA is not the deciding factor. We have a holistic admissions process. I'd say if we see that you've done, okay, this is actually a good opportunity to address this. Patient care experience. Not all patient care experience is equal. Okay, so people commonly ask, well, how can I get as much experience as possible, as quickly as possible? Well, you can take an EMT course and get a job as an EMT. You can get a doctor to let you work as an MA in their office. Just keep in mind that front office MA doesn't count for medical experience. Back office does, taking vitals and assisting with procedures. So make sure you indicate that it's back office assisting that you're doing, not front. If you're managing the charts and the billing, that doesn't really count as far as PA school. If someone has 2 years experience as an RN in the ICU, and someone else has 2 years experience as a scribe, which one has more medical experience? It's pretty obvious not all medical experience is equal. So if you're just trying to fill in a box to get into PA school, that's not enough. It may be enough to get your foot through the door, and you may get lucky. Someone may really like you, and that's happened to some people that we've let in. You just never really know. Some people just shine on the interview. But if you're at an entry-level patient care experience, try to move yourself up to something that's more hands-on, more decision-making quality type of a position. So I'd recommend that. For our program, the personal statement, it's important that you, as someone on the admissions committee, all the personal statements start blending in with each other. I could give you 10 or 20 of them, and after you start reading through them, they all start looking the same. They all start off with some type of little story, and they all, it's just, once in a while, there's something that really catches our eye. But what we're really looking for in the personal statement is what made you decide to be a PA? It's not just what the experience is, but why PA? If I understand you want to go into medicine, but what made you decide to become a PA? That's a whole different question. And then what type of PA do you want to be once you graduate? And that's quite often an interview question. Okay, so where do you see yourself in 5 years? And a student needs to be able to describe what type of specialty, what type of population, what location. You need to have a dream, and you need to be able to describe what it is. And that's really important. If you have a dream and you're clear on what your goals are, and you're able to convey that in your personal statement, that goes a long way. Because as you saw with with Dean Jameson, she was saying it's all about fit, whether you're the right fit for the school, and it really is.
Mhm. So a follow-up question there as well that we have. Some students sometimes are told not to be too specific in their application or in their personal statement. People tell them, "Oh, don't say that this is the kind of PA that you want to be because they won't. Maybe they're looking for something else, or so on and so forth." But it sounds like your advice to the applicants is just to be honest and say why PA and how you see yourself or where you see yourself.
My advice is to always be honest.
Mhm.
You're doing yourself a disservice if you're telling a research institution that, oh, I want to do research, and you really don't. Or you go to a program that's really geared toward underserved, and your real intent is to do Botox in Beverly Hills. Okay, you're not doing yourself any service by not presenting yourself fairly. So please be honest on your application.
And I think that has rung true with all the speakers that we had. And every speaker that we have is always impressing the importance of honesty and really saying what you're there and what you would like to be. Let's see, I'm just going through our Q&A here. Oh, here we go. Oh, we have some specific questions about whether patient transporter at a hospital count towards the experience. And you were elaborating on this one before, that not all hours are equal.
It certainly can count as patient care experience, but remember how you describe it in there is really important, because people on admissions boards look at all the fine print. We read your description. So if you say medical assistant, our first question is, okay, what type of medical assistant? What did they do? And we look in that description for keywords or key terms that they're doing vital signs. They're assisting with procedures. We're looking for those type of, they're giving injections. We're looking for those type of things. Medical transport. If that involves any type of taking vital signs or monitoring vital signs, make sure you have that in there. You may take that for granted, but that needs to be in there. Whatever you can do that shows that you have patient contact and some type of medical aspects will strengthen your application.
Right, and I can say at least someone as a student through the application process is that a lot of students are feeling, you might feel like, oh, well, this is not that great of an experience. I only did it for this amount of time, and they have this habit of downplaying themselves. But much like you just mentioned, Dr. Forrest, it's how you explain, what it did for you and what you were able to do for others. What you get out of it is much more important than what the like you mentioned before, than the black and white that's on the paper.
Convey that on the statement.
Right. But yeah. Make sure
those are the really important things. I want to know where your heart is, and if you're able to describe that and say, "This is, I'm caring for these patients. I take this seriously," and describe that briefly. I mean, those things matter.
In terms of the clinical hours, do they have to be paid, or are there options? Can you have clinical hours that are volunteer and or shadowing?
The way CASPA set up is unusual, and let me describe that. Patient care hours, according to CASPA, are paid. And then if you're volunteering, that goes into the volunteering section. So it's still patient care experience, but it needs to be looked. It needs to be looked in a different aspect. So take a look at the categories that CASPA has, And because you're not being paid, it doesn't mean that it's not a health-related experience. So health-related experience, there's no definitions on. So I don't believe. So you can take a look and see how to work that. I'm not the expert in that, so I'd say speak to an admissions counselor who works with CASPA. That would be my best advice.
Perfect. And we have another question, it's on the theme of the volunteering and what you have seen from applicants. I think Dr. Forrest mentioned, really that the school's looking for where your heart is, and we also will be able to provide you guys with some resources. I think the difficult thing is for students to find volunteering opportunities. And so we will link some things in the chat as well. If you have anything else to add, Dr. Forrest, I know you mentioned that as well.
I will, if I may. Keep in mind that a lot of shadowing opportunities are limited because of HIPAA. And hospitals don't want someone they don't know coming in and shadowing. You have to go through a whole process. It's worth going through the process to be able to do that. But if you can volunteer in a hospital, that's one way around it, because you can be shadowing as you're volunteering. You can't double dip, but you can certainly do that. Small clinics don't have the same HIPAA regulations. So if you go to a small clinic and to a PA that's working in a small practice somewhere, and tell them, I want to shadow. Can I shadow you? I will tell you right now, even though they don't have it, they're probably going to say no, because they don't know you from Adam, and they're not going to let you come in and see patients with them if they don't know who you are. So try to build a relationship with them. Talk to the, email them, ask them about PA programs, get to know them better, and then with time, ask them if you can shadow them. And that's one way of doing it.
Yeah, and I think that's something we've heard today as well. To reiterate that it's definitely difficult to get in the hospitals, and for prospective students to look into smaller clinics and try to find their way in. Dr. Forrest, thank you so much for being here. We're going to close with one more question. It has been a real pleasure to learn about the program and to have you here. So last question is, in reference to CSU Monterey Bay and the program, what do you feel like the most important characteristics are for a PA going through your program? And yeah.
Great question. Grit. And there's no way really to describe grit. Grit's a word that incorporates tenacity, determination, willing to overcome obstacles. We look for that in interviews of people. We ask questions to see whether people overcome obstacles in their lives. We want to know that people can have a desire to succeed that's going to keep them going. That grit is probably the most important thing to put them through.
Perfect. Thank you so much, Dr. Forrest. Really appreciate you taking time, especially on your weekend, and being with us throughout the day. So we cannot thank you enough.
You're welcome.
All right. Shortly, I believe we are going to segue over. We're going to have some students joining us. So hang tight with us for just a few moments and we will get started.
We'll say, Luis, while you're getting that ready, I can kill just a little bit, a minute or two if you want.
Oh yeah, that would be excellent. I didn't want to keep so much of your time, but thank you. Yes, please.
Sure. Let's see here. I will just a couple observations as being in a PA for so many years. I'd say if you're able to get a primary care education or a primary care job when you first come out as a PA, that's going to give you a strong foundation for whatever type of specialty you want to go into later on. So I normally recommend graduates to go to do their first couple years in a primary care specialty. It gives a good foundation because PA school is giving you all the basics, but getting the experience on a different level where you're making all the decisions is huge. So I'd highly recommend that. I think if there's anything else that just going through the questions here. Leadership. Some programs, every program has different things that they're looking for. And so for some programs, leadership is really important, and you need to be able to show the leadership positions you've been in. Because of our goal and our mission to care for underserved, leadership is an extra. We would love to see that happen. We have great leaders in our program, but it's not a prerequisite to get in. So take a look at each different program. Each program has different prerequisites. Some require GRE, we don't. Some require a certain number of hours of clinical experience. There's one program, I believe, up in Washington that doesn't require any experience at all. So take a look at all the different opportunities and find one that matches you.
Dr. Forrest, I thought it might be actually a great time, given that you've had so much experience and so many years as a PA. A few things that we've mentioned today: leadership and clinical practice and the team healthcare model. What have you found throughout your years to be maybe, your most important takeaways, what it means to be a PA, if you could enlighten us?
Oh, one of the huge benefits of a PA is lateral mobility, but you won't get lateral mobility if you narrow yourself down too soon. So if right immediately out of PA school, you go into dermatology, and I'm not picking on dermatology, but trying to think interventional cardiology, something that's very, very specific. When it comes time to move sideways to another profession, you're going to have to go back to primary care and rebuild your strengths before you go into women's health or before you go into another specialty. So don't take the lateral mobility for granted. You need to be keeping up on all your skills in order to be able to do that.
Excellent. Thank you.
Sure.
So we are joined by two students now. I see Lizette and Mario. Just wanted to check in with you.